Okay, how are you guys doing? This is Mike Johnston here, and we're going to start off with the second video that instructs us on how to input drugs and prescriptions into our EMR for PAP application processing. So I'm going to go ahead, I'm going to bring up my patient, my test patient, by searching patient, and we're going to look for the test patient, which we are going to be using to input these prescriptions. And I'm going to click on the first one. That was one we were just using in the last video. Here is a copy of the lecture notes that we had from our video that corresponded with the insulin program video. Remember, we talked about insulins. They are very different than the oral medications. They take a little bit more time to quantify, so we determined to get the correct dosage and quantity for our patient. So let's go ahead and input the Novolog 7030. So we're going to input the Novolog 7030. So in order for us to do so, we're going to go back here to scripts, and I know I have to input a new script for this patient. But before I do so, I'm going to go over here to drug inventory, and I'm going to search for a new one. Actually, if you didn't see how I did that, you could go over here to drug inventory, open drug inventory module, and then we're going to search for Novolog, N-O-V-O-L. And notice I did so. Notice all the different drugs that have Novo in the name. Novolog, Novolog Mix 7030, Novolog Flex Pen, Novolog Regular, Novolin R, Novolog Mix 7030 Flex Pen, and Novolin R. So hopefully we can recognize now that the Flex Pens come as a injection. They come as an injection via a pen. So Flex Pens are the injections. The 7030 is the mix. It is the intermediate, the short-acting, and this is just the short-acting insulin. This right here, Novolog Mix 7030, without being said Flex Pen, comes as a suspension, and that is a 10 ml vial. Novolog by itself is a 10 ml vial, and these Novolins don't apply to the specific PAP. So this is the basic idea, and if we click on this, this will give us a hint. So let me click on Novolog Mix 7030. Notice when I double click on Novolog Mix 7030, it gives me a package size of 10 because that's based off of the ml, and there are 10 mLs in this package size, and we have a package quantity of 1 because when they send us a box, each box has 1 vial, which is 10 mLs, which is a little different than if I go down to the Novolog Mix 7030 Flex Pen. When I click on this, and these are the exact same medication. It's the exact same medication. The only difference is the way that it is administered. One's a vial, the other one's a pen. But when I click on this one, notice the package size is 3 because every pen has 3 mLs versus every vial that had 10. When they send a box, each box has 5 pens, and that's why the package quantity is 5. So we can use this drug inventory module just to check to make sure that we're on the right path for administering and properly inputting the correct prescription drug and the correct quantity. So let's go back now to test patient. I'm going to open up his scripts, and I know that we are going to add a new prescription, but the drug is not the Novolog pen, even though it was asked for. I'll scroll in here just so we can all remember. The drug, even though it was asked for the Novolog pen, we know that we can't get the pen. We can only get the vials. So since we can only get the vials, we cannot input for the pens. So in this circumstance, we're going to add a new prescription, and notice the provider for this one was Cotti. So we're going to type C-O-T-T-I and hit enter, and now we're going to type in Novolog. I'm just going to make it Novolog. Notice everything that populates: Novolog Regular, Novolog Flex Pen, Novolog 7030 Mix. Okay, so I'll even make it bigger so we can see it. Notice I can't get the Flex Pen, the solution pen injection. That's S-O-P-N. I can't get that one. And I say, okay, what am I getting here? I want the Novolog 7030 Mix. So clearly I'm going to pick this one. It's a suspension. Its route of administration is subcutaneous. It comes as a 10 ml vial. So all of these are indicators that I'm choosing the correct mix. So I double click on that and I check again. Okay, Novolog Mix 7030. That's what I wanted, Novolog Mix 7030. And even though I wanted the pens, I can't get the pens, I get the vial. So I am okay with choosing this selection. I chose the correct selection. So now my SIG is inject 30 units subcutaneously twice daily. So I'm going to write this out very clearly. Inject 30 units SQ, this is really nice, twice daily, BID. When I hit tab, it spells everything out for me. And then I review it. I say, okay, inject 30 units subcutaneously twice daily. And I check on my prescription, and I say, okay, inject 30 units subcutaneously twice daily. That's what I wanted. I look here, and inject 30 units subcutaneously, BID twice daily. I'm happy with that. So I put that in correctly. Now we have to put in the quantity. Before, when we did this, the quantity that we're going to input is based off of mLs. So that's going to be a quantity of 60. I need 60 mLs to arrive. Even though I only need 5.4 vials, I need 60 mLs to arrive because we can't split up a vial. So my prescribed quantity will be a value of 60, and my supply days, as we said, with these will be a value of 90. Supply days will be 90 with 3 refills. So we're going to have 90 with 3 refills. I check everything, and I recheck, and I triple check, and I quadruple check, and I hit save because I am happy with that. So now I know the PAP department will take this and they will process the application. Notice here it gives me a warning. A warning came up saying, oh, be careful. You might not want to mix Lantus with Novolog. Watch out, intermediate versus long-acting. Not a good idea. Be careful. So this gives you another drug-drug interaction that you may want to flag, that maybe the provider did not realize this one patient was on both of those medications. It could actually really cause some problems if you have the wrong drugs and the provider did not know that the patient was on both drugs, and maybe the patient didn't know they were on both drugs either, and they forget to inform the provider. So again, always keep everyone on the same page. If you see a drug-drug interaction arise, look at it. Take a couple seconds and review it. This is not a race. Working in pharmacy and with medicines and with your providers, it is no race to see who finishes first. So now we will continue on. So we finished this drug, Novolog. So now we're going to go down here to our Lantus. So this was our Lantus. Okay, we remember Lantus. Okay, that's fine. That means we can get it through pens. We can get Lantus through pens, so we're going to choose pens. And we want the pens, even though it wasn't specifically declared on the prescription, we know we're going to get the pens. So when we do the prescription entering, we are going to have to recognize that we want pens. As I said before, Lantus is indicative of, Lantus Solo Star is indicative of pens. So now I'm going to add a new prescription. It's not Cotty Rosh anymore. It's not Joe Cotty Rosh. Now it's Ham. So we're going to come back over here and take out his last name and type H-A-M. And notice this populates. I'm going to choose this one right here. And now I have to type in Lantus. So notice we have two different options, Lantus and Lantus Solo Star. One dosage route of administration will be solution, the other one solution pen injection, the route of administration subcutaneous. And notice one comes as a 10 ml vial, the other one comes as a 3 ml pen, and we're going to choose the pens because we can get the pens for the Lantus. And it gives you a little heads up. It says, uh-oh, be careful. The patient has one active prescription for this drug. Are you sure you want to do it? And you say, okay, yes, I need to do it. We're practicing. It's going to give you some of these errors. And if this were to happen with a patient and you were working in the pharmacy with the providers and the nurses, flag them down and say, okay, this patient for some reason has been on it before. Did he or she tell you? We also want to be careful, and it never hurts to ask, never hurts to do some research. So say, okay, in this circumstance, I'm going to not discontinue that other script. So I'm not going to discontinue. I should hit cancel. So now I'm going to input the SIG. The SIG for this was inject 60 units QD QHS subcutaneously. So inject 60 units subcutaneously every day at bedtime. So I'm going to type it, inject 60 units subcutaneously QD QHS. So notice I typed in those exact SIGs, so it makes sense for the patient. When I hit tab, I now get everything out spelled for me. So now I'm going to indicate this is a PAP medication, so I have to put in the star, and then I hit tab, and that gives a PAP. And then I go down to prescribed quantity, which we already calculated. I know that I need 18 pens, but this only works as a value as mLs because that's how this doses is in mLs. So I'm going to type in 54. This is for 90 days, and prescribed refills are 3. Now I've checked everything. I've rechecked it. I've had another person come and check it for me, and I don't want to make a mistake. I'm going to hit save, and now this will go to PAP, and PAP will take it from there. I noticed that with this one, I did forget to input the PAP star, and so I'm going to put that here, and then I'm going to save it to make sure that I don't make a mistake. So I want to make sure that's a PAP medication. So notice now when this is completed, we're going to go down to our next one. This was the Humalog. This was the Humalog. And remember, it just said Humalog, but Humalog we could obtain the pens. So when we input this, we're going to input the pens. So the provider is still Ham. So we're going to get the patient some Humalog. Typing it in. Notice here I get, okay, let's look at this. So I get Humalog, Humalog, Humalog. What does this mean? So notice here I have the solution. The 10 ml is populating. I see that the pen is here, but I don't want the mix. So I got to go back and check my drug inventory. So I have my drug inventory. I'm going to cancel this, and I'm going to check my drug inventory. I'm going to search now for Humalog. And notice, okay, Humalog Quick Pen is here, but for some reason it was inactivated. So I had to come back here and I will have to inactivate the drug, so I'm activating it, and now I hit save. Now I hit save. So now it is available to be prescribed. When I go back down here to test patient RX, I'm going to hit enter now on Humalog, and notice now it populated. Humalog Quick Pen, because that's what I wanted. I wanted to have that quick pen. I need that pen. It's easier for the patient to administer. It says solution pen injection. It's a subcutaneous route of administration, and it comes in 3 ml pens, every box of 5. So we're going to choose this one to be the one that we are ordering and prescribing for this patient. Now we will read the SIG. Okay, this one's a little more convoluted. So the first line I'm going to put is do not exceed 45 units. I think it was 45 units. 45 units daily. So when this prints on the prescription application for the pharmacy, for the national pharmacy distributor, this will be the first thing they see, and that's how they're going to also check that we requested the correct amount of drugs, the correct quantity of the drug for our patient. So now I'm going to put in the scale. So now I'm going to say on the next line, use according to sliding scale, carb counting scale. I'm going to indicate that. So use as directed. Use as directed from the carb counting scale provided. And I'm going to maybe even star this, so that way I'm going to star this and I'm going to hit the PAP, so that way that I know that this is not a very clear dictation, but I'm going to add one extra caveat here. Notice it says do not exceed 15 units per meal. I'm going to put in here do not exceed 15 units per meal. But I also have to say that we will have to inject this once before every meal. The whole idea about this drug is to inject this drug before each meal. So notice this is sort of a continuing development for the SIG. So we will have to inject insulin, Humalog, prior to each meal according to scale. And then it says, okay, do not exceed 45 units per day. Notice it went all the way over, but that will print on our script. It's okay. And then we're going to use as directed from the carb counting scale provided. So again, there's a lot of stuff going on with this one. I'm going to put a note afterwards just to indicate, saying make sure the dosage is checked when the patient comes, so that way he understands how exactly to administer this drug. There's a lot going on with these carb counting scales. They are very convoluted, and they probably have a little scale sheet that comes along with this. On our prescription pad, on the prescription label, it's maybe 4 inches by 2 inches. It's very small. So putting all this information on there, I will show you what it looks like. It looks very small. So now we're going to put the prescribed quantity, which is 42. This will be 90-day supply, and prescribed refills will be 3. So everything that I put on here is going to go right on that prescription. So now we're going to save it. What I'm going to do is I'm going to show you what this looks like, and I'm going to go to print script, but I'm going to print with preview. I don't actually want to print the paper. So notice this is what actually populates. So this will be sent to the national drug company, the manufacturer, and I can't remember which one. I think maybe I can't remember. Maybe it's Boehringer, Ingelheim. I think that's the one that does Humalog. But that's what populates on here. So it gives quite a bit of information. But that's going to be the prescription that goes into, that's sent. So that's the prescription that's sent. The little sticker that goes on the insulins is even smaller. So I'm going to show you what that would look like, just to give you an idea. I'm going to fill the script, assuming that it came in. I'm going to add it, and I'm going to delete it afterwards. And I'm going to save. Now I'm going to print preview this one. And this is actually going to be what populates on the sticker sheet that we apply to our pens. And notice how small this is. Let's see how small it is. It's very small. Inject Humalog prior to each meal according to scale. Do not exceed 45 units daily. Do not exceed 50 minutes per meal. So it gives you all of the information, but it's in very small lettering. So I'm going to put a note in here, and I'm also going to delete this fill because it didn't want to fill it. I just want to show you what the paper voucher, the paper sticker that prints when you print the label for this prescription. I just want to show you what it looks like. But I'm going to put a little note in here, and I'm going to add a note. I'm going to say this prescription has a difficult sig. Please discuss heavily with the patient prior to dispensing. So hopefully the patient will get very, very good education on how to administer this drug, because these sliding scales can be a little confusing, especially if this is a new time they've been on it. So I'm going to save this note, and now this note will populate every single time that someone opens up this prescription. Notice a warning came up, and notice it says we have a drug-drug interaction. We have one between Humalog and Novolog, and then Humalog and Lantus. So notice it has some duplications. It gives you a whole convolution of exactly what's going on. If this were to happen with a provider, you would say, okay, let's be careful here. We got some drug-drug interactions. Are you sure this is what happened? Did they tell you what they're taking? Do they know what they're taking? Are they really taking it? So this is something that we're going to discuss. So that's what that one looks like. So now we're going to come down to our next one. So this one's going to be Levemir, and even though they wanted pens, remember we can't get pens, we have to get the vials. So now we're going to add a new prescription. The provider here is Ham again, so we're good there. So now we're going to type in Levy, and notice I get a couple different things. So notice here they have Levemir Flex Pen, Levemir Flex Touch. And you say, okay, which one do I want to use? Notice these are both solution pen injections. We know we can't get Levemir as a pen injection anymore. We can no longer get the pen injection. They're really the same thing. They just renamed it. We're going to have to get the Levemir vial, which is going to be this one standing alone. Notice it comes as a 10 ml vial, so that's why we're going to choose the second option for the patient. We're going to input the SIG, which is inject 50 units BID. So we're going to inject 50 units. And I'm going to put SQ so they know it's SQ. Subcutaneously BID. I hit tab, it comes down and it populates the correct SIG. And I hit Shift A and it gives me the star. I hit tab again and I indicate a PAP. My quantity for this will be 90. It will be 90. It will be 90 for 90 days. So we're going to get 90 for 90 days with 3 refills. And I hit save. That's a nice one, very easy. Another warning pops up because this patient's on so many different insulins. So we're getting an insulin-insulin interaction, and that's normal. So again, is this what happened with a patient? Make sure to flag the provider. On to the next one. So notice here, this is going to be a Humalog pen. So this one just has a larger sliding scale. You say, oh my goodness, that's so long. But we're just going to have to type it in. We're going to have to force through it and type it in. So I'm going to have a new prescription for the patient. The provider here is Ewart, so we're going to change that to Ewart. And we're going to click on Ewart. And now the drug will be Humalog. I believe it's Humalog. And it was Humalog. We want the pens. So we're going to request the pens. So we're going to click on Humalog Quip Pens. Notice these bottom two are the 75-25, so be careful. We didn't select that. That's not what we wanted for this patient. We want Humalog Quick Pens. It's the pen injection, and it's a 3 ml pens. So we're going to click OK. We currently have an active prescription. Do you want to discontinue the old prescription? We're going to say no, I don't want to DC anything right now. I'm just going to keep going through it. And now I have to put in this sig. So you will inject Humalog. Inject Humalog subcutaneously prior to each meal according to scale. If blood glucose, they know what BG is, blood glucose is, so notice the first one's 150 to 200 to 200. I'm just going to put colon 1 unit. Semicolon 201 to 250. Colon 2 units. I'm going to go down the next line. I'm going to say 251 to 300. 3 units. 301. Now I have to do my semicolon. 301 to 351. 4 units. I'm going to say, I'm sorry, 301 to 350. It was 301 to 350. And notice I'm just doing this right here. So 350 was 4 units, then 351 to 400 is 5 units. So 351 to 400 is going to be 5 units. So notice it says do not exceed 5 units per meal. So do not exceed 5 units per meal. And then I'll have to put a little star here to indicate PAP, and I go down. So I know that I've input this long, very, very laborious SIG, but this is a sliding scale. I'm going to actually indicate in my notes to make sure one of the nurses, providers, or pharmacists goes over this with the patient and make sure they understand how to do this. Now I'm going to input this prescribed quantity, which is going to be 15. Relatively nice. And the supply days will be 90 with 3 refills. I can hit save, and I get another one that populates, which makes sense. We now have another one. And I'm going to put a note in here, and I'm going to say make sure to discuss sliding scale with patient prior to giving them the prescription. So I'm going to put that in there just because it is very, very, very difficult to follow these instructions sometimes. So sometimes we write on the bag for them. We do it a couple different ways so that way they don't have to be confused. Many of our patients will work with Carlos, who is our diabetic specialist. He's a great, great nurse, and he really spends a lot of time educating them so they understand how to follow their protocols and their therapies. So he does a great job. But again, this one's a very tough SIGs because it has the sliding scale. And I think that is the last one. Oh no, we got one more. This one I'll do a little bit faster. This is Humalog, but this one's 75-25 pens. And again, we've gone over this before in our lecture. So I'm going to add one more. So the provider here, I didn't write a name, so I'll just assume it's Ewart. So I'm going to say Humalog. Notice I want to choose the mix because she went for the mix, 75-25, and we can get the pens. So I'm going to double click on this one or hit it and click on it once and click OK. I'm going to follow the SIG, which says inject 30 units TID subcutaneously. So inject subcutaneously 30 units TID. So notice here it spells out exactly what Dr. Ewart wanted us to write. The prescribed quantity is going to be what we calculated, which is going to be a value of 81, 27 pens, which will be a value of 81. This will work for a supply date of 90 days with 3 refills. I'm going to hit save, and this is relatively an easier SIG to understand, so I don't have to worry about that one. Yes, I don't have to worry about that one. So, so hopefully this helps you entering in these prescriptions for the patients, and if you need to go back and practice this a couple times using the test patient module, and if you have any questions, please let me know. mjohnson@healthandhopeclinic.org. We have a great day. Bye.